pilot randomized crossover study comparing the efficacy of transnasal disposable endosheath with standard endoscopy to detect Barrett's esophagus. Introduction. The incidence of esophageal adenocarcinoma, EAC, has increased dramatically in Western countries over the past 30 years. However, despite advances in staging and treatment strategies, the 5-year survival of patients with this diagnosis remains poor, indicating the need to detect this cancer early to improve outcomes. Barrett's esophagus is the only recognized precursor to this cancer and can be monitored over time endoscopically in order to detect neoplastic changes at an early curable stage. Retrospective series have shown that endoscopic surveillance of Barrett's esophagus leads to detection of EAC at an earlier clinical stage. However, the data on survival benefit remain controversial. The discrepancy among studies can be explained by the evidence that surveillance only improves survival from EAC if it is conducted with strict adherence to the recommended protocol. Within this context, screening programs for Barrett's esophagus have the potential to reduce mortality from EAC. A valid screening test needs to be inexpensive, accurate, well-tolerated, and applicable to primary care. Currently, the only validated screening test for Barrett's esophagus is standard endoscopy, which has major limitations. It requires sedation that increases the risk of adverse events, prolongs the length of the procedure, and adds direct and indirect costs. In addition, the standard endoscopic equipment requires decontamination, which is labor-intensive, time-consuming, and incurs additional costs relating to reprocessing machines. Hence, population screening by standard endoscopy remains controversial, and specialist societies recommend it only in high-risk individuals. Unsedated, ultra-thin transnasal endoscopy has been shown to be feasible, well-tolerated, safe, and accurate in evaluating Barrett's esophagus. In addition, transnasal endoscopy is estimated to be cost-effective compared with standard endoscopy. However, these endoscopes require the same decontamination process as standard endoscopes. A novel transnasal endosheath endoscope, TME 5000 with endosheath technology, Vision Sciences Inc., New York, USA, has been developed to circumvent the need for reprocessing and to allow use in a portable office-based setting. The device comprises a reusable ultra-thin endoscope with an outer disposable sterile sheath. The processor, light source, and screen are integrated into a portable digital processing unit, which is the size of a briefcase. The system has not yet been evaluated in a randomized crossover design for the diagnosis of Barrett's esophagus. The primary aim of the current study was to evaluate the sensitivity and specificity of transnasal endosheath endoscopy, TEE, in diagnosing Barrett's esophagus with reference to the endoscopic diagnosis made by standard endoscopy. The secondary aims of the study were as follows: to evaluate the sensitivity and specificity of TEE for a histologic diagnosis of Barrett's esophagus with intestinal metaplasia using the histopathology assessed on 2 random biopsies taken during standard endoscopy as the reference to compare the optical quality of TEE with that of standard endoscopy and to compare the patient tolerability and preference for the 2 procedures. Background and study aims. The transnasal endosheath endoscope is a new disposable technology with potential applicability to the primary care setting. The aim of this study was to evaluate the efficacy of transnasal endosheath endoscopy, TEE, for the detection of Barrett's esophagus by comparing the diagnostic accuracy of TEE with that of standard endoscopy. Patients and methods. This was a prospective randomized crossover study performed in a single tertiary referral center. Consecutive patients undergoing surveillance for Barrett's esophagus or referred for diagnostic assessment were recruited. All patients were randomized to undergo TEE followed by standard endoscopy or the reverse. Endoscopy experiences and patient preferences were evaluated using a questionnaire. endoscopic and histologic diagnosis of Barrett's esophagus, and optical image quality of both endoscopic procedures were compared. Results. A total of 21 of 25 patients completed the study. TEE had sensitivity and specificity of 100% for an endoscopic diagnosis of Barrett's esophagus and of 66.7% and 100% respectively for the histologic diagnosis of Barrett's esophagus. The mean optical quality of standard endoscopy was significantly better than that of TEE. However, following endoscopy, patients reported a significantly better experience with TEE compared with standard endoscopy, with 60% preferring TEE and 25% preferring sedated standard endoscopy. Conclusions. In this study, TEE had equal accuracy for an endoscopic diagnosis of Barrett's esophagus compared with standard endoscopy, at the expense of reduced image quality and a lower yield of intestinal metaplasia on biopsy. TEE was better tolerated and preferred by patients. Hence, TEE needs further evaluation in primary care as an initial diagnostic tool.